graph. Okay? So, and also including the bundles. Please listen, everyone. Okay? So, if the MOH will come and will ask you how you will know about the compliance rate in our hospital, what will you answer? How often we are putting the compliance rate and the graph in the hospital. So, quarterly, we are posting all the graphs and bundles and also year end. So now I'm explaining to you the year end graph. So this one, hand hygiene compliance. So for the hand hygiene compliance, we have two lines here, which is the blue and the red. The blue represent the 5 moments of hand hygiene, while the red one is the procedures. So you can see here, from 2018 to the whole year 2020. So the 5 moments, you can see that it was decreased, but just a little bit. While the procedure of 5 moments, alhamdulillah, it's increasing. I don't know if it's true. I know. Okay, so can you tell me again what are the 5 moments of hand hygiene? Just to refresh our minds. Okay. Okay, before touching the patient. Before aseptic before touching the patient. Before any aseptic technique. After any body fluid secretions, then after touching the patient, then after touching patient's surroundings. Okay, you should memorize the 5 moments of hand hygiene, guys. Okay, then how many seconds is the hand washing?
40 to
40 to
60.
60 seconds. And the hand rubbing?
20 to 30.
Seconds. Okay, so show me again how you will do the hand hygiene. What are the steps? So, remove all the jewelries first. Then, then,
Kasi Micah, alam niya to, memorize to.
like this. Then, finger interlace. Finger
May ganun-ganun pa si
interlock.
Micah sa uli. May ganun.
Yes. And the other side. Then, to the thumb. Okay. Then, rotational. No more wrist, ha?
No more
Because remember that when you will do like this, the palm to palm, you will
Include the wrist.
include the wrist. And also the finger interlace, you will include the wrist. Always remember the steps of hand hygiene, okay? Next, because we are in the surgical department, for the SSI, standardized infection ratio, you will see in this graph, okay, that all the procedures who developed HAI for the year 2020. So, this is all the procedures, okay? So, with the SSI, it is shown that there are how many?
13
Total of 13
observed cases.
observed cases that develop surgical site infection for the whole year 2020. Okay? It's a bit high, okay?
Observed.
Yes.
All CS the highest for the observed cases of SSI. What's AII?
Saan ang AII dyan?
Total?
Yes, this one.
This is the total.
All procedure.
All procedure.
Okay. These are the procedures by number of how many SSI developed. Well, these are the total of all the procedures done. Okay, but the predicted is still 15.14 below the observed, but still 13 is a high number. Okay. So next, for the observed counting. This is for the general wards except the ICU and CCU, guys.
All wards.
All wards.
All
So same with
wards,
Unit 5, huh?
Yes. All general wards. So this one, we have 7 cases with county observed, while 4.01 is the predicted. So, as you all know, the red one is the observed case, which is developed healthy inside our hospital, the red one, okay?
For the
While,
you have 7.
yes, for 2020, huh? While the predicted one, it is statistically computed by our statistician, okay? So, you can see here that 2019 we have less. So, in 2020, we increased the county rate in our hospital. So, it should be, we should comply with the county prevention bundle. So, first of all, county prevention bundle, you have to what? What is this? What are the steps for the county prevention bundle? You have it there? You can see it, okay guys? First, you have to check for or ask the doctor if this one
Foley catheter is
still
needed.
Okay, and also if it's still needed, you have to put stamp,
Foley cat
ask the
stamp.
doctor, then to tick what is the indication of the Foley's catheter. Then also for the securement, also you will put like the duoderm, you are using the duoderm or the medical tape, that one, huh? You have to place the catheter bag on the, if you are putting it on the left, you put the catheter bag on the left side, not on the other side, okay? And do not forget to drain if it is already, how many?
3/4 of the
full,
bag.
okay? And also if you will going to transfer the patient, do not forget to drain, okay? Okay. Next, for the observed versus predicted CLABSI in our hospital. For 2020, we have 8 cases of CLABSI, again for the whole general wards, which were observed while the predicted is 1.97. This means that we are really increasing. The rate for our HAI for CLABSI is increased in the general wards. Before we have 6, then now it's 8, more than the predicted cases. So you have to observe, always observe again for the compliance of central line care in our hospital. Okay? You should know first, you have to check for the any redness, tenderness, or any signs that there is already infection. If you will see any signs of that one, you have to alatul inform the doctor so that maybe it will be, for sure, it will be for removal. Okay? Then also for the dressing change of our central line, how often are we changing the dressing? If you are using the chlorhexidine, chlorhexidine is 7 days. But if you're using the gauze only, how many days? Huh? Gauze. It's daily. Yung semi-permeable, yun yung
3 days.
Yes. But if you will see that the dressing is soaked with blood or already dirty, you have to alatul change and not wait for the day. Okay? Then, always do hand hygiene. Do not forget, every time you are doing any procedure, do the hand hygiene. Before accessing the port, you have to always scrub the hand. Okay? But for all the lines pala and contractions in the hospital, you have to always ask for the indication of this one. Because as much as possible, if it is not needed, we have to remove all the contractions. Because we do believe that the longer the contractions is staying in our body, it is the higher risk for infection. Sa? Ma'am Karin?
Hindi ko narinig, sorry. Ulit. Pang Miss Universe.
Okay, that the longer the lines is staying in our body, the greater risk of
Infection.
Of course, of course.
Wait lang.